Hello, Alison. How's it going?
Good. How are you?
I'm doing well. You are from Willow Creek Behavioral Health. Yes. And we're here to talk about you guys and about mental health in general here in Northeast Wisconsin.
Right.
Mental health is something that with us here on Razor we take very seriously. We have a whole page devoted to it. And I've struggled with many factors within mental health and trying to be open about it. But as I'm a 35-year-old guy. I grew up in the era of, well, man up, you got this, that type of thing. Can't be that bad. Just go for a walk. But it can be much more than just needing to do that. And that's why you guys have a great facility. And tell me a little bit about Willow Creek.
Sure. So Willow Creek opened in January of 2017. We have inpatient and outpatient service lines. We take care of child and adolescent patients as well as adult and older adult patients on the inpatient side. And on the outpatient, we have adult and older adult programming. We also are there for individuals who have substance use disorder and need assistance with managing that illness, and whether it's medically managed detox or just maintaining their sobriety.
That's something that I think gets skipped over with mental health is substance abuse. And you said it's a disease. I've never heard that before.
Substance use disorder is absolutely a disease. Many people struggle with it, and oftentimes people with mental health will struggle with it because they're self-medicating their symptoms.
And it's okay to admit that you've got a problem, but sometimes it's hard to say that to someone. What in your experience that you've seen has been a big breakthrough for people within the community?
I think the stigma is getting less. We talk about it more. The pandemic definitely impacted a lot of individuals' mental health, and it had to become part of the conversation. We saw a great increase in our adolescent population really struggling with the isolation, and that has trickled into young adults and adulthoods. Parents struggled with their children who were having mental illness symptoms. They themselves were struggling with it. And so the stigma is definitely reduced, but it is absolutely still there.
Yeah. And you were saying earlier before we started recording that when you initially started, you didn't have the adolescent program, but then that was something added because you saw the need for it. What was the conversation like to get that rolling?
Really, it was with the community, and they needed somewhere for these kids to get help. And the schools were big influencers in that. The school social workers and counselors had nowhere to refer these kids to who needed more assistance than they could provide.
Yeah, and Willow Creek, where are you guys located, by the way?
We're on the east side of Green Bay.
Okay.
On Ontario Road.
Gotcha. Okay, so right in the Green Bay, the heart of Green Bay, and you work with schools and you work with the counselors. How important is it to have those people in the schools?
It's essential to adolescent wellness. Absolutely essential. They are the first line of defense. They have eyes on these kids every single day and can work closely with their families and their support systems to be able to identify red flags sooner than later.
I've got 2 small children, and every day I get worried that somehow I'm going to mess them up, or that something is going on in their mental health that I won't be able to see happening. What are as a parent, is something that I can look at my child and be like, oh, maybe they need to go and check something out?
That can be very difficult because there's normal adolescent development. Our kids have a lot of screen time. They interact with their peers through their screens now versus previous generations who you were out in the neighborhood or you were hanging out at a park. And so they self-isolate, but they're having social interactions virtually instead. That makes it difficult for a parent because you're not necessarily recognizing what those relationships are like. Are they healthy? What are they truly looking at? The fact that you're worried about it shows that you care about it. And so you pay attention to normal behaviors in your children. Are they eating? Are they interacting with family members? Are they practicing good hygiene? Are they involved in their school? How are their grades? And the biggest things are looking for what's different. And is that different because they're struggling, or is that different because they're growing and maturing and developing? Know their friends, be involved in their life. You'll see the triggers much sooner. Adolescents get moody. Their sleep schedules get messed up. They're going back to school now, which is really exciting for some kids, but it's terrifying for others. It can be a major stressor in some adolescents' lives because they have social anxiety, or they struggle with school in itself, or they're limited in friends. Bullying happens and we don't know about it because they don't want to say. So really just being cognizant of the differences in your child and what their day-to-day life looks like is what's going to trigger you as a parent. You know your kids. You know when something's off.
So Willow Creek Behavioral Health, you guys started back in 2017. What was the initial spark to get things going?
Mental health needs in this area.
Okay.
There's 66 of the 72 counties in Wisconsin have a shortage or no psychiatric providers. That excludes Dane County and Milwaukee County. They're very large urban areas that have great resources, but the majority of the counties in the state are lacking and needed more support. So really it was just a community need to meet those resources. And we feel very differently about mental health. We are not simply a medication stabilization, 2 or 3 days. You come in, you get some meds, and then you go about your life. It's no different than any other disease in that if a pill was going to cure it or a pill was going to fix it entirely, we wouldn't need hospitals. We wouldn't need outpatient clinics or urgent cares. And so we utilize a treatment program, which helps people to develop coping skills and manage their triggers and recognize their triggers in a safe and secure, structured place while medication is being managed and stabilized for those individuals. Our outpatient programs have 2 different layers, and so those are day treatment programs, is what most people would know those to be. We have a full day treatment program that still has a psychiatric provider involved once a week to manage medications, but not everybody needs medications. And so we have a partial day program that has the group therapy modalities or the group therapy programs, so they can still develop those coping skills, identify their triggers, help to involve their families in their wellness until they're able to step down to potentially a once-a-month therapist visit or a once-a-month psychiatrist visit.
You know, I think one of our goals is to open up our minds to how the treatment happens, you know, because we've been bombarded with lots of media, of movies, books, and things like that that always show the mental asylum and like everything's scary, you know, Arkham or One Flew Over the Cuckoo's Nest. How can we dispel that as that's far gone, not even a thing anymore? How is Willow Creek different then?
So I think our programming is the important part to think about. On an inpatient or a hospitalized patient, you are going to groups all day long with other individuals in talking through different educational options for diagnoses, but also processing your particular experiences and illness and circumstances. But we're not just sitting in a room talking all day long. We have recreational and occupational therapy to develop leisure skills. Some people don't know how to relax. We have to teach them how to do that. We have courtyards where we're outside in the grass and doing yoga or different activities outside. Our adolescents still go to a classroom for an hour a day. It's not about pushing school, but classrooms can be a big trigger for those kids. And our teacher recognizes those. She's a very seasoned educator, and so she is able to identify and work with schools for when these kids leave. So, you know, we go to a cafeteria and you go through the line and you pick your meals. This is not a bunch of people that are sedated and sitting in chairs like those movies will portray.
Sure. Well, we've talked about adolescents and them getting the help. You know, as an adult, maybe someone, if you've gone through a traumatic event and now you got a lot of emotions going on, you don't know how to regulate that. Because like when we were young, regulating emotions wasn't a thing. Right. How does an adult, you know, some of us might not have a support system to be like, hey, dude, go, you need help. How do I see that within myself? And then how do I get help?
You had said earlier that we grew up with the generation of suck it up, get over it, deal with it. And that we're seeing every day in the news is not working for people. And so I would say recognize your health from the neck up as much as you do from the neck down. So if you would go to the doctor because you weren't feeling well, why aren't you going to the doctor because you're not feeling well? That would be my biggest push, is it is okay to ask for that help. And if you get brave at 2 a.m, we are there for you 24 hours a day, 7 days a week. Come on in. No cost assessment. And if we're not the right place for you, inpatient's not the right place for you, maybe outpatient is. If outpatient's not the right place for you, we're going to help you find the right place. Because that is our commitment, is to make sure that when people do take that step forward to get the help that they need, that they get the help that they need.
Absolutely. That 24/7, that's something that I did not know about this going in. But that's just like a hospital then.
Correct.
And that's because mental health is physical health as well.
Absolutely.
Let's talk a little bit about the resources that Willow Creek Behavioral Health provides beyond the there in person. You've got a great website. What can we see and expect when we go there?
So you're going to come into our lobby. It doesn't look unlike many other lobbies for hospitals, and you're going to go to an assessment. You're going to meet with a master's prepared social worker or a licensed therapist, and they're going to do an initial assessment with you. It takes about an hour. We get into the weeds a little bit to see what you really, really need for assistance. And so once that's determined and we discuss with you what your options are or what our recommendations are, we move forward with that treatment plan. If you choose to admit with us, we have a full multidisciplinary team. And for a lot of people, that doesn't mean anything. So what that is that we have psychiatric and medical providers. We have therapists, social workers, nursing, behavioral health associates, rec therapy, occupational therapy, as ever discussed, a teacher for education, dietitians to help with nutrition. You get a full team to help you manage all of the aspects of your wellness and getting you back to where you can feel safe and be able to be out in the community and live your life and be with your family or friends, go to your job, go to school, etc. You're usually going to be on the inpatient hospital with us right around 7 to 10 days. Again, we're not just talking about a magic pill. That's not how any illness is treated. So you're going to be with us, but then we're going to have discharge planners and patient advocates to make sure that when you leave us, you're not just off on your own again. We didn't push you in a boat out to sea and let you figure it out in the community. We work very closely with mentor programs, outpatient providers that offer services that we don't. If we talk about the substance use, we work very closely with residential and sober living facilities so that each individual patient gets the care that they need.
Let's talk about your path through mental health so we can personify us a little bit. What got you on this route to where you are now?
I'm a nurse by trade.
Okay.
I've been in healthcare 30 years. When I was a direct care nurse, I was very much in the trauma field of emergency departments and ICUs. You see a lot of mental health issues in emergency departments and ICUs, not just with patients, but with their families and everything that they're struggling with. And so as I continued my education and got into leadership and operations, I had read about Willow Creek being opening in the area and really felt passionate about making sure I did what I could as a healthcare professional to have it be successful. So I left my operations position and helped open Willow Creek. Wow,
what a leap of faith. And an amazing program that is necessary in Northeast Wisconsin. And I'm going with you're a nurse, and my wife is a nurse. And she, during the pandemic, she actually got what a lot of nurses experience burnout, and was just overwhelmed with the everything that was going on with the pandemic. How did you guys get your staff? Like, how do you pick the people to work for Willow Creek?
So it's not unlike any other specialty in healthcare where you're looking for people who potentially have experience in that field, but that is not easy to do in this area because there isn't a lot of mental health providers. And so We work very closely with candidates who are potentially interested in mental health to see their why and what is it that makes them choose to come to us. Our employees are our number one customer. If they're not taken care of, our patients aren't taken care of. And so we work very hard on making sure that we have the right staff that are going to be able to develop that structure and develop that therapeutic relationship with patients while still being able to recognize and treat the illness. So it is not easy. We are very, very lucky in that our staff stays with us. They're passionate about our why, and they're passionate about Willow Creek, and so they stay. And we don't have a large turnover at our hospital, which just makes us that much better at what we do because our staff know what each other is thinking before it even has to be said.
I think passion is something that is absolutely necessary in this, and I hope that we can stir up some of that with our community to go and take care of ourselves. If there's one thing that a misconception that's out there that you would like to rectify, what would that be?
It is not a choice to have a mental health illness, and that is a lot of why don't they just stop it? Why don't they just take their meds? There is so many layers to managing this level of wellness. It is not a choice. So if you have somebody in your life or you are struggling, please recognize that it is okay to ask for help. You would do that for any other part of your body.
That's the best statement that I've heard. It's not a choice. It is not. I suffer from anxiety because I have severe ADD, and it is so hard some days to just crack the eggs, to make that omelet, to make the food. Everything is going on. It feels like rushing and everything, it can be frustrating for people around, and imagine how frustrating it is for the person suffering. They want to be doing the right thing. They want to be out there, in a normal society, being able to walk through a grocery store and remember why you're there, So it is important to know that, and yes, go and get the help. It's because it's worth it.
It is absolutely worth it.
Alison, thank you so much for sitting down with us and talking about Willow Creek Behavioral Health in Green Bay. Hopefully we can help eliminate some of the stigma.
I appreciate the time. Thank you.